And as I turn on the recording, I want to introduce you to our speaker, Jan Lynch. Jan is the director of the Help and Resource Center at the Marfan Foundation. She has practiced nursing in a variety of clinical settings, both inpatient and outpatient. Jan also was a nurse educator in colleges of nursing in New York and was the nurse editor for Nurse.com, a national nursing magazine. She received her BSN from Georgetown University and her MSN from the University of Pennsylvania. So now I'm going to click down and I'm going to give the mouse over to Jan so she can take us through the presentation. So Jan, are you all set there? Thank you.
I am here, and we'll test in a moment to see if I can switch the slide. I hope I can. Thank you, everyone, for joining us. This is really pretty exciting to have us all together. I am focusing on, as you can see, self-care and empowerment strategies. And I'm going to try to switch that slide now. Let's see if it works. Yes, so, oops, switched it too much. I think I've gone.
Do you need help going back to? Do you need help going back to the beginning?
Actually, whichever side. Thank you. Whichever side.
Let me get that. Let me
go forward. Thank you. And now
okay,
I know that one click will bring it. So anyway, this webinar will focus on the following topics. Eileen will get to that. There we go.
Okay, and back to the beginning. There you go.
Okay, great. Thank you. So the webinar will focus on three main topics, and that is practicing self-care, enabling yourself in your care, and organizational tips and tools. And really what I've decided that it all comes down to is nourishing ourselves, enabling ourselves, and organizing ourselves, all in an effort to improve our own self-care. And that's the fancy way of saying it, but it's really nourishing, enabling, and organizing. I just have a little bit of few items of business. I am available by phone or email if you wish to discuss anything related to this webinar with me or anything at all. I'm here as the director of the Help and Resource Center, and I talk to many people every day and by email as well. And I feel that it's really great because we can brainstorm together and help you come up with some solutions in the issues that you're facing. The second item of business is that pain management is not part of this webinar. We will be holding one on this very important topic in the upcoming months. And Eileen has already mentioned about the follow-up handout, which includes all of the information I am sharing with you today and then some. And when I say then some and a lot, I'm not covering everything, so I thought this informational follow-up handout would be helpful to everyone. Actually most of these suggestions that I am presenting in this webinar come from people in our community, whether it's from my talking with people on the phone, and I learned so much about how people are coping and what they're doing. And some of them have come from some of our more experienced individuals in our community. I wrote to them and said, give me your thoughts on these two particular areas or topics, and they were very kind to share their thoughts on them. So some of them may even be on, and they'll be hearing some of their recommendations. Keep in mind, though, as we go through this, that some things will suit you and some things will not. There's no right or wrong in this webinar. There's no shoulds or have-tos. So keep that in mind as well. So let's talk about self-care first. We all hear healthcare professionals stressing the importance of self-care in our lives. And we've got to remember it's not about being selfish, but rather about the need to take good care of ourselves. And that's important. We do that to help ourselves mentally and uplift us, even while we're struggling with our own physical well-being and those related issues. In fact, I think that we need to practice self-care at those times even more. And so we'll talk about that. What self-care practices can you consider adding to your life? Well, let's in order to be successful, I think that we need to make them small, manageable, and attainable. And I say those words and pause because we won't do them. We get to the end of the day and, oh, well, we didn't get to me, and that's too bad. So I have some resolutions that different people in our community have presented to me, and I'm going to try to switch this and see if it works. Yes, they do. And I picked out 4, and I have others, but I picked out 4 that I felt were resounding themes from the people that I speak to on the phone and those that I connect with by email. These may or may not work for you, but they're 4 that I feel I keep hearing others talking about. I will focus on myself and how I can improve myself, both physically and mentally. I will not compare myself to others. I will try one positive, healthy action every day. For example, drinking more water, taking a walk, improving eating habits, meditating, reading a good book, or practicing mindfulness. And then each month or each week, I'll change it up and try another positive, healthy action. I will ask for help from others when I need it, whether it's for something small or for something big. It does not mean that I am weak or helpless when I ask for support. I will recognize when I need to pace myself and when I need to take a break from whatever I am doing. Self-care may mean doing less in my day rather than more in my day. And so those are just 4 that I picked out from I think I have about, you'll be getting that handout, about 10 or 11 other ones. And I'll just do a couple of more that I felt are also important ones. I will recognize each and every time I have accomplished something positive for myself and let myself feel good about that accomplishment. It might be something small, like taking a rejuvenating walk, or a bigger one, like making an important doctor appointment or starting to solve a medical issue. It's about giving ourselves credit, you know, it's patting ourselves on the back and treating ourselves like we treat others. And that's a resounding theme that you hear from people who talk about self-care, is the fact that we often treat ourselves much worse than we treat others. We are better to other people. So let's treat ourselves like we're other people. I will find people who can serve as confidants or mentors who I can brainstorm with, whether in person or by phone. And this one was particularly meaningful to me because there's so many times that I speak with people in our community on the phone, and a lot of times it's just about our brainstorming together and coming up with solutions that can work from them. And that also is related to finding people in our community that provide support that are in similar situations to us, not necessarily the same, but similar. And I'll take one more in this group. In a notebook, I will write down specific issues I am having. For example, it might be recurrent headaches, sleeplessness, GI issues, pain, immobility, and how I am trying to deal with each of them. And that gives us, I think, a little clearer image of where we want to head with that issue. When we write it down and we list below how we're dealing with it, what's working and what's not. And I even had someone else in our community recommend that write worthwhile suggestions. People are, as you all know, are always giving us suggestions, right? Can everybody hear me? I'm seeing people say that I cannot. Jan is fairly quiet. Can you hear me? Is it okay? I'm not getting a response, so I'm going to keep going. But I hope that
Jan, I hear you totally fine. I hear you totally fine. Just wait one sec. Let me just see what's going on in the chat box here.
Okay.
Maybe if it's light on your end, guys, turn up the volume on either your computer or your phone, because I'm hearing it pretty clearly. So
well. Okay.
people are saying that they're saying that they're good. Okay.
Okay. So
okay, great. Thank you, everybody.
I lost my train of thought. Anyway, then the last one, then we'll move on, is when I have to do something I don't enjoy, I will also try to do something that is enjoyable or rewarding on that same day. You know, we all in our community have many things that we don't enjoy doing, that we need to get done. And so given that, we need to give, and I sort of view it when I am speaking with people in our community, we give gifts to ourselves. You know, we treat ourselves. We treat ourselves as like we would treat other people. So there's more recommendations here on these self-care tips, and I'm going to move on, but by all means, look at the handout, and I welcome to hear from you on some of the tips that work from you. I would be remiss in not mentioning mindfulness, and what is mindfulness. And not that I think that this is the only strategy that helps people in dealing with life, but it's certainly one that has come to the forefront. People are increasingly being taught mindfulness in hospitals, corporations, classrooms, you know, even professional sports people are being taught it. And I'm going to talk about it just for a little bit. It really, what is mindfulness? Let's just, because we hear that word lots and lots, it means being steadily aware of something rather than jumping from one thing to another. So it's being steadily aware of those things around you in your environment, or being steadily aware of what's going on inside your body. And I'll explain that in a minute or two. Let me just move on to the benefits. Mindfulness has lots of benefits. It brings important information about what's happening around you and inside you. As you practice being mindful, and we're going to talk about that in a minute. Oh yeah, I have to move on my slide. I forgot about that. See if it goes on. Okay. As you practice mindfulness, it gets easier. Your awareness increases, and negative experience have less of an impact on you. It really helps you to take in positive experiences. There are studies that have shown that using mindfulness actually changes the brain, so that you get better at attention, you become more self-aware and more empathetic, you help to control and reduce negative emotions, and you reduce the impact of pain. It actually decreases pain. Mindfulness in its practice is simple but not easy. But like any skill, it gets better and easier with regular practice. And you'll start, experts say, and I have a niece who has hounded me for a number of years about mindfulness. She is a mindfulness instructor in Michigan. She works at, what is the name, Mindful World. And she says that she's one of my experts, and I've spoken to several other people that practice it, but you actually start feeling happier, calmer, and more resilient. It starts with awareness, whether you sit in a quiet room, close your eyes, and do mindful breathing, and just close, if you want to even do it now, close your eyes, and you stay focused on the sensation of your breath, allowing it to be your anchor. And if your mind drifts away, you quietly bring it back and just gently breathe in and out. That can be practiced for 2 minutes in a day, 3 minutes in a day. There's also mindful listening, where you close your eyes and you just listen to those sounds and noises around you, not making judgment, but rather just listening, keeping your attention to those sounds, gently coming back to them as you catch your mind drifting. Now, there's, needless to say, many of you may already know, there are apps and you can go right on your computer or download them for a mindfulness practice. And I've just listed them. You can get them from the handout or also when you come back to the PowerPoint. They are, if you put in Google Headspace, Calm, Insight, it's Insight Meditation Timer, sorry about that. And Buddhify is another one. Is that one listed? Yes. And those are guided imagery where, for example, an Insight Meditation Timer, there's deep relaxation. You click on it, and this woman begins to speak and helps you to relax and do the mindful breathing and the mindful listening. There's so many different ways you can help yourself with mindfulness. For example, even just driving, or you're commuting to work, or you're sitting at home on a weekend, and you can just sit and look and listen to those sounds and noises around you. You don't need to have any fancy app or tool to guide you, but some of these are very helpful and very easy. And I also have a book that I use. It's called Just One Thing, Developing a Buddha Brain, One Simple Practice at a Time. And it's by Rick Hansen. And he has different sections of the book. You can actually read like 2 pages at a clip. It's being good to yourself is one section. Enjoy life is another section. Build strengths, engage the world, and be at peace. So if on a particular day you want to read about and engage yourself more into being at peace, you can read from that section. So I reached out to a number of people in our community, and I listened to those who are coming to us about how they are proactive in their care. And this is the next section. Remember, I said nourish, and now we're on to enable. And so one little side thought that I put there is proactive in your care does not necessarily mean that you're doing everything yourself. Seeking others' input and help is part of the process. So I found when I gathered this information about being proactive and how people are enabling themselves, it fell into 3 categories. The first one was the physical and mental health and well-being. And that's how this section, I'm going to just mention a few of those. And again, I'll say again, this informational sheet, that follow-up sheet, will have many more for you to enjoy and perhaps apply to your own life. So here are some of the tips that I thought I'd like to share this afternoon. Try to do a regular scan about how your life is going and what areas are out of balance or underfed. A gentleman in our community really liked the life scan that's available in the book called Nonviolent Communication. He uses it as a reference to identify when life seems off for him, and it helps him to scan this tool in this nonviolent communication, helps you to look at your life and where do you want to focus more energy or more time. Another gentleman recommended this. Try to do regular energy scans where for a couple of weeks you keep track of how you are feeling and doing, what seems to be getting in the way, how you might change, how you order your day to be more effective. This particular person in our community got this notion when working with a pain management clinic. He would do, when he was part of this pain management clinic, he had to do hourly check-ins over a period of a few weeks. And it became very clear as to what parts of the day were better for physical activities or mental activities, what things aggravated his pain levels, and when he needed to rest. Gain an understanding of what you take joy in and arrange certain aspects of your life to suit that. For example, someone in our community, he wanted to improve the food that he ate. So he started working on learning how to cook more. This particular person likes to know the underlying science behind things. So he learned to cook from a group that experiments with recipes and tells you why they work the way they do. Allow more time to complete just about everything. You may not be able to rush, and maybe you don't even want to rush, but the whole idea is to allow more time to complete just about everything. And I love this one because I think this one can really apply to just about every one of us, if I dare say that. Mean it when you say self-care is a priority for you. Be sure to take time aside for us. For many of us, it is often the last thing on the list, and then we have no energy left for it. One woman in our community takes a bubble bath to ease the pain. She meditates. She does things that bring her joy. She posts positive affirmations. She tries to make a list of self-care things that work for her and keeps it to refer back to, and picks one each day or each week. And then the last one for the whole physical and mental health and well-being that I thought was a great one is sleeplessness or poor sleep is often an issue in our community. And this person recommended to try to set up things ahead of time and keep organized. So a bad night's sleep or a day with more pain doesn't completely throw you off. It's terrible, really, how sleeplessness or poor sleep interrupts us and affects us. So this one person in our community sets out his dishes for breakfast the night before. He sets out his morning meds and supplements in a small dish for the PRNs, the ones that are as needed. He often makes up a list of things he needs to get done for that day. For example, calls or visits or work things that he needs to get done. And even if he starts his day feeling like a zombie, he can get going and avoid the frustration and aggravation of a challenging start. He also does large batch cooking. So when he makes something, it'll be enough for 6 to 8 servings, and then he freezes the rest. So I thought that was some helpful hints from the physical and mental health and well-being. And remember, there's more on the follow-up handout sheet. The next part that I found in the enabling end of things that people contributed to my question were related to communication. And here are a few of them. Encourage your doctors who are supportive of your care to communicate with one another, so to help improve your care and their communication between all specialties. And this, can be frustrating, and I've heard so many people in our community expressing the frustration, but I think if we try to aim for that as something that will make it better for us, improving our quality of care and speeding up care coordination when there's emergencies, I think we all try to aim for that, but sometimes it's not always what we would like it to be. Seek to have a good working relationship with your primary care provider. He or she can see you frequently for follow-up and can brainstorm with you regarding what specialist to see. And I'll never forget, I had a conversation, this was maybe a year ago, with a physician a geneticist who's wonderful in our community. And we were talking about the difficulty with people finding good primary care people. And also, sometimes we don't all live in areas that are, that may have access to a number of physicians. So he really was of the belief that, yes, find somebody who's willing and open to learning, who will work with you. It's almost like in the center of this hub with you, if you know what I mean. And then these specialists are outside the hub like little prongs, and you are together in this. You are a team together. When you go to any physician appointments, be sure to share, and I use this term loosely, obstacles you have in life. and ask for their feedback as to how to overcome them. For example, an obstacle might be pain in performing daily routines, immobility issues early in the day, and keep, I always, this one, I love this one. My father lived till he was 96, would you believe? But his thing was that he would repeatedly ask the same question, and he'd come up with this broad array of tips or words of wisdom. And I think that's helpful for us to keep those, say, 3 or 4 things that are our obstacles in our life, and keep asking people, and here the words of wisdom can come from unexpected places. Okay, let's move on to knowledge is the third one that was in the enabling portion of this presentation. And someone, I swear I did not put this one in, someone from our community said, try to attend the annual Marfan conference every year, if at all possible, and seek out the information and advice you need. The sense of community we share is very important. And this person added, the Marfan conference is like a family reunion. And I'd like to just add into that, we have other ways if you can't make the annual conference, certainly because if it's geographically not desirable for you, we have symposiums and walks and other ways for you to gather with other people and network and talk about your obstacles and hear what other people's words of wisdom are. Ask a lot of questions when seeing any healthcare provider. Ask the healthcare person to explain why they think what they do. I love that. Think when someone presents something to you, you don't need to nod and say, mm-hmm. You can say, well, explain to me why you think that. Why are you suggesting that? Why do you think that's what is something I need to do? Why, the other questions are, why do you want to run that test? What do you expect to learn from it? Why is that important? And then another one that I think many of us do, but I think it's worth mentioning here, is once you find a physician with experience treating Marfan individuals, ask them for referrals to other specialists, whether it's cardiologists, ophthalmologists, geneticists, etc. And certainly you can come to us. And I'm getting a little nudge that I've got to move on here, so I will. The next slide, I love this. Let's pause for a moment. So the tips to get the most out of your doctor appointments, and I wasn't planning on, this is an article that you will find that I wrote, is on our website, and if you put in tips to get the most out of your doctor appointments, I have a list of, these are just 3 of them that I picked out, but there are 11 tips for when you go to the doctors and how to help you make it a more valuable appointment. So that, and there's 11 tips on, and it's on the follow-up sheet as well, but also you can find the actual article on our website. So let's move on to the third portion of the program, and that is the presentation is organizing. And this, I'm always amazed at the many different ways that people in our community figure out how to keep track of everything. And it's not easy, certainly, it's not easy, but we can all do it. And, I can tell the age group, some use filing cabinets and folders, and others use, their phones and other ways, and we're going to talk about them in a minute. But so here are some tips from people in our community that I thought were worth sharing. Keep all your medical information in specific files, and I added in on the side here, or in your on your phone or on a hard drive, a little shared drive. Have your list of medications, including supplements, allergies, doctors, and brief medical history with you at all times. And I'll repeat that. Your list of medications, including supplements, allergies, doctors, and a brief medical history with you at all times. One person in our community finds this very helpful for not only when she sees a new doctor, but at one time she was taken to the ED because she had a minor car accident, was brought there, and she was very happy she had that with her. One that came up a number of different ways from people in our community was using your calendar on your computer to keep track of your appointments with reminders. And you can set the reminder, as many of you may know, but if you don't, you can set the reminder for a few days ahead of time or a day in advance, whatever suits you. And we're fortunate, most medical offices do give reminder calls as well. As far as staying organized and keeping track of information, try not to rely on your memory. Write everything down, whether it's in your phone or in a book, whatever way works for you. When you visit a doctor, that also applies. Be sure to bring in a bulleted list of what you need to discuss with him or her, and take notes while you talk with him or her. How many times have we left a doctor's office and we've forgotten to ask one of the questions? Let's see here what we have. Okay, and here's some, the different ways that people have used to organize themselves. And I want to get to, this is one, a specific person from our community. He actually recommends, and if you see, there's lots of different pill boxes here, and not because pill organizers, and because he keeps like the ones that he's taking in the morning in the kitchen. And then he has the ones by his bedside at night by his bedside. He keeps that pill box, the pill organizer. He also, that little black box there, flat black box, that's actually his, it can keep it in his wallet. It's called a credit card USB drive. And he has that ready, which has all of his medical information. It has his latest labs, his films, his emergency information document as well. This same gentleman actually is writing an article about keeping your medications organized. As you can see, he's got it down. And so those of you that are interested in connecting with him, I know that he would love to either speak or email with you. And let me just see here. I think I'm into this is also the same gentleman. He did not mind that we share his name with you, but he keeps a list. This is of all, he has them labeled, as you can see in PDFs, all of his x-rays, his EKGs. He's a king of being organized, as you can see, and just wanted you to know that this was another way of organizing so much of what we have going on in our lives. And let's just see if there's anything. I know I'm skipping some things because we're moving along here, but the one thing I do want to mention, and it's sort of, make sure that when you're in different offices and having tests done, that you're getting an electronic or hard copy of your results, whether it's lab work, EKGs, echoes. You want to have them in your possession. And it's just so much easier to get them while you're there. And most offices are becoming better at that, where they know you need that information. So, but you take that responsibility to make sure that you have that information. And I just wanted to mention here, and I think Eileen's going to also speak up at this moment in this slide too, that we have a number of other ways to support you. We have a mentor-mentee program where, you can access it through our website, but I can give you the link if you'd like it. You can email to me at jlynch@marfan.org. And you fill out a survey, and then depending on your age and what you request, if you want to be a mentee, then we assign you to someone who will help you, who has offered to be a mentor. They may not be geographically in your area, but it's more your needs and what you're looking to get support for. You know, it might be someone that's similar age group or has had the same situation that you've had, whether it be surgeries or whatever. We also have a number of support groups that are ongoing. I facilitate a newly diagnosed and 50-plus phone support group. Please write to me if you would like to join either one of those at jlynch@marfan.org. They are a wonderful way to receive support and talk about tips. My 50-plus phone support group is amazing. They have tips that are, you know, when each person presents and gives their current issue, and then everybody brainstorms and helps. Susan Leshin, who is a social worker in our office, she is running a Gen X, which is 30 to 50 age group, and also a pain support group that is starting soon, I think in the month of April. So be sure to email Susan if you'd like to join that, and she'll give you the details. It's Leshen, Leshen, @marfan.org. And now I'd love Eileen to speak, Eileen Micheli, on our social media and how we provide support in that way.
Thanks, Jan. You're doing such a great job. I can't believe you needed me for this. Our Facebook page is we are the Marfan Foundation on Facebook. There are a lot of different Marfan groups, but look for the one that's the Marfan Foundation, and that is the national organization's Facebook group. There's more than 18,000 people in that group. We share a lot of information from the foundation, links to resources on our website, links to videos on our YouTube channel, information about what's going on around the country. But there's also, you can also send us a Facebook message, and we will either send you the link or get the question to Jan. Really, Jan's our frontline person with all your inquiries. But if you forget her email address or you know what to do, you certainly can come to our Facebook page, and we monitor that pretty much all the time, and so we will get back to you. I also want to mention two other things. One is Connect, and that is our own social platform, and that's accessible through our website, marfan.org. You just go to the bottom and you click on Connect. If you're not on Facebook, then you can go on Connect, or even if you are on Facebook, but if for some reason you don't want to be on Facebook, you can go to Connect and start your own profile, and you'll see groups there of all different interests, whether it's geography, age, issue specific, and you can connect with people there as well. And the one other thing I wanted to say about organizing your medical care and your medical information, watch for a big announcement from the Marfan Foundation in the next month, 4 to 6 weeks. We are going to be launching the Marfan Syndrome and Related Disorders International Patient Registry, which is going to be an app that we're working on with Backpack Health, and you can check out their website to learn about them. But it's going to be two things. One is a way for you to track all your medical records and track your family's medical records, and it will also give us an opportunity for those who approve to be in it to do research in the future based on the experiences that are shared there. So that'll be another tool, and you'll be hearing a lot more from the Marfan Foundation on Backpack Health and the International Patient Registry that will really help you manage all your medical records. So Jan, back to you.
Thank you, Eileen. Yeah, that's great. Thank you for mentioning that. And there's so many ways I do notice from the various people I speak to on the phone that people are using our website. Use the search bar for community activities, for information. Just fool around with it, spend some time on it, and that will be, you'll figure out other ways. Certainly you're welcome to call me or email me. Please be patient. I never mind reminders if I haven't gotten back to you by email. pretty good about the phone, but with the emails, do not feel funny at all, reminding me that I need to respond to you. And I just thought I'd end with, I can't change the direction of the wind, but I can adjust my sails to always reach my destination. And I hope that we've provided you through this hour presentation and for many more webinars to come, and through the informational follow-up sheet, we provided you with some ways to feel like you can reach your destination. And then the other one by St. Francis of Assisi is start by doing what's necessary, then do what's possible, and suddenly you are doing the impossible. So thank you so much for listening, and I welcome any comments, any additional tips that you want to share with people, any questions. Now you can put them in the chat. It's called
the Q&A box. They should go in the questions should now go in the Q&A box. So if you have any questions for Jan, type them in there and I will share them with her. And if you have any suggestions that you'd like to share with other people, that would be great. I do have one question, Jan, that came in ahead of time, and that was one person who is looking for ways to take care of themselves and, and really do some of the things that you've talked about, but they're really challenged by the pain that they're in. And so while you're not talking about pain, how can you really take care of yourself and overcome that while you're dealing with pain? Like, how do you put the pain on the side and do some of these techniques that you've offered here?
Well, that's the million-dollar question, Eileen. And that overrides so many times for the people in our community. And I've been in the fortunate position to hear from our 50-plus support group, various ways that have worked for them for pain. And they've, because they're 50-plus, they've tried it all. So whoever wants to email with me, I can share you that list of their often out of the medicinal world for pain management, and what other people have recommended to me. I'd love, and I think I do better with, working with each person and telling me where the pain is and what they can do. That would be great. Okay,
and there is a question about if there is research happening with pain management and medical marijuana for Marfan, and we definitely will be addressing that in the future. I don't know of any research exactly going on right now related to Marfan, but we are going to have a future webinar on medicinal marijuana and what the facts are that are known now. Even in general, it is different by state, but we're going to try to equip you with what's known and what questions to ask, and watch for that, because that is an important topic when we deal with pain management. And as Jan said, we're also going to be doing a whole separate webinar on pain management as well, too.
Yeah, I know that I see Jan asking that question, Jan Mayer. I know, Jan, that in my 50-plus phone support group, there are several people that are very knowledgeable about the use of marijuana and pain management. And as Eileen just mentioned, state to state, it really varies, because some have access to it and are successfully using it, whereas others do not have access to it. But Jan, if you email me, I can connect you with several people who are in the 50-plus support group who can give you a little more information about that. Not necessarily the research yet, but what the practical end of it is.
So I don't know if you see this other question, Jan. I'm wondering if people want to, people are starting to ask a lot of questions that are not related to self-care so much, but if you want to take a few minutes to answer some of these about somebody who was wondering if they need to see a geneticist. They don't see one anymore. They still see their cardiologist and ophthalmologist. Is it necessary to continue to see it?
That's okay, Scott. You're welcome to call me, but certainly, if you've been diagnosed either clinically or genetically, but, with genetic testing, certainly you do not need to see the geneticist. However, if you feel like you're wondering, because our genetic panels have expanded and improved, and we're able to identify more specific genetic disorders. We used to have, it was very general in years gone by. Certainly that's worth going and revisiting. But if you're not covered by insurance, that's a whole nother issue. So you're welcome to call me, Scott, but I hope that helps you. Yeah, I've heard, I see anonymous attendee asking about cramping and stiffness. Epsom salts I've gotten rave reviews from people in our community about the use of it. Good, I'm glad it helps, Scott. And you can call me also at 516-883-8712, extension 126. As far as the Epsom salts getting rave reviews, and apparently several people in our community have mentioned to me that they don't use there's like you can get like a big bag of it, and they give it like a specific amount to put in per, whatever. They've actually make it very strong, because that seems to help them.
Okay. Thank you very much for that, Jan. Does anybody have any other questions about self-care in today's presentation? I want to again put up on the screen Jan's information. I know she's given it out several times, but in case you couldn't get it while she was saying it, there is her email address and her direct extension. And she is totally open to helping you guys, as you can hear right here on this call. I mean, she's amazing. She's always there to help.
I gotta tell you, I'm so learning from everybody in our community, as you have seen. Oh, I love this question, the physiatrist. The social worker in our office and I have had a number of conversations about physiatrists versus orthopedic people. The thing about
why don't we ask the question, because not everybody, I don't know if everybody can see the question about does a physiatrist help with Marfan? So why don't you go on?
So I would say a physiatrist who knows about those with Marfan syndrome and related connective tissue disorders, those would be the individuals that I would first make sure that they have knowledge and or preferably even treated or cared for. The beauty of a physiatrist is that that person sees you not as a leg or a knee or a hip, but rather someone who has that the knee is related to the hip. And that is so important for people in our community. We can't segment our joints, right? We need to consider them all. But I just caution, and, I have just begun the pulling together of physiatrists who may be knowledgeable. I can't say I have a huge group of them, but I think it's worth visiting one in your community, as not to send you on a wild goose chase, but if you feel that could help you, because they're more open to the whole body experience, if you know what I mean.
Very good. Thank you. Thank you very much for that question.
Yeah, it's so funny. We've been tossing that around and about in the office now too.
So I don't see any other questions right now. So I want to thank Jan for sharing all this information with us tonight. I also really want to thank the Chu and Chan Foundation, which helps support this webinar series. And we've gotten so much great feedback on it. So thanks to the Chu and Chan Foundation for their educational grant, making this possible. As we've said multiple times, you can go on marfan.org for more information, and you can also contact Jan. Our next webinar is on April 23rd, and we're kind of going to continue along this self-care kind of theme. The topic, as you can see there, is mental health and chronic illness, and really take another look into what you can do for yourself. Stephanie Randazzo, a doctoral student in clinical psychology who has Marfan syndrome, is going to be the speaker. And Susan Leshin, our social worker, is really excited about her. Stephanie's clinical practice and research is on mental health and chronic illness, and I'm sure the information she will present will help you increase your quality of life. Again, you can register on our website. Go to marfan.org, patients and families, and then on the left side, you'll see the empowerment series. So thank you all again for participating tonight.
Eileen, someone is just asking, where is the handout found?
So the handout is going to be, you're going to get a follow-up email from us in the next couple of days, and it's going to have a link to the recording and a link to the handout. So you will have all that information in one place. There'll also be the link to the survey. So you have everything you need for the follow-up from this presentation. Will be right in your inbox in the next couple of days. So thank you for asking for that. And if you have any questions about that or about anything else related to this topic, or basically any Marfan related disorder questions, Jan is your person. If you have any suggestions for future topics for these webinars, there's my email right there, and you can also contact Susan Leshin. Her email is up on the screen as well. So thank you all for participating. Jan, thank you so much. I know you worked really hard on putting this together for us. And I hope everybody
so happy I could do it.
I hope everybody has a really great night. Thank you all.
Thank you.